Knowing how to respond properly to an opioid overdose can mean the difference between life and death. It's critical to know how to spot and immediately respond. This may include using Naloxone, a life-saving medication that can reverse an opioid overdose. An opioid overdose stops the body's automatic drive to breathe, which means the body quickly uses up its entire oxygen supply. At the onset of an overdose, you have 4 minutes to respond before irreversible brain damage occurs. Time is critical. Here are the signs to look for. The person's not breathing or is breathing very slowly, possibly with gurgling sounds. The person is unresponsive to loud sounds or attempts to wake them. They have blue lips or blue fingernail beds. And they may have tiny pupils, which we call pinpoint pupils. You might also find a pill bottle with an opioid listed on the label, or needles nearby, or wax or paper bags containing opioids. You could also see white powder around the person's nose, or an injection mark. Remember that the person may not display all these signs. However, if their breathing has dropped to 8 or fewer breaths per minute, you may need to administer naloxone. We'll talk more about where to get and how to use naloxone in the next lesson. But first, follow these steps. Check for breath by placing your hand on their chest or abdomen to see if it is rising and falling, or place your ear to their nose to listen for breath. If there is no breath, check for a pulse. This can be done by using your index and middle finger to feel for a pulse at the side of the neck just below the jaw, as I'm showing you here. If there is no pulse, start CPR immediately and call 911. Either way, treat it as an overdose and immediately administer naloxone, the opioid blocking drug. When emergency services arrive, provide them with as much information as possible about the person's breathing status, pulse, signs of an overdose, nearby evidence of drug use, and the amount of naloxone you administered. While waiting for emergency services, continue to check for breathing. If it has stopped or slowed again, be prepared to administer more naloxone. There is no reason not to. So, to recap, check for breathing and other signs of an opioid overdose. Check for a pulse. Administer CPR and call 911 if there is no pulse. Administer naloxone if the person is not breathing or if their breathing has slowed and there are other signs of an overdose. Then call 911 if not already done. We suggest writing down your action plan, reviewing it periodically, and keeping it somewhere easy to find in case of emergency. We hope you'll never have to use it, but having a plan can save a life.